Hello, this model represents the human torso. I am going to direct you with terms of our directional and regional terms and the language of anatomy. Starting with superior is anything towards the head. Inferior is anything towards the bottom of the human body. That means here and then all the way down to the feet. This will be the right side of the body. When you are observing a patient, your right side is their left side and their left side is your right side. So this is the right side of the body. This will be the left side, okay? Also, medial and lateral. Medial is when we're going to go straight down the midline of the body. Midline, meaning the mid portion of the body that can divide it into two halves, okay? So anything towards the midline of the body is considered medial. Anything towards the away from the body is considered lateral. So let's do an examination. The nose is medial because it's in the midline of the body. The ear is lateral because it's away from the midline of the body, okay? Now, let's take the ear and the shoulder. The ear is now closer to the midline of the body in comparison to the shoulder. So the ear is medial in comparison to the shoulder, which is lateral, okay? We are also going to talk about proximal and distal. Proximal is close proximity to the attachment of the body. Distal is further away, okay? So proximal and distal are two terms that we discuss when we are referring to the limbs, the appendicular division of the human body, okay? So proximal is anything closer to the body, and distal is anything that's further away. So proximal, the most proximal will be the shoulder because it's closer to the attachment of the body at the shoulder joint. Distal will be the fingers and the toes. Distal meaning they are distant from the attachment from the shoulder joint and the hip joints. Okay. Anterior and posterior. Anterior means anything towards the front of the body. The breasts are anterior, the eyes are anterior, the mouth is anterior, okay? Posterior will be anything, sorry about that. This is the posterior view of your torso. And posterior is anything towards the back of the body. So the back of the head is considered posterior. The buttocks, gluteal, is considered posterior, okay? Anterior and posterior also have two terms that mean the same thing. They are ventral and dorsal. Posterior, the back of the body, is dorsal, and anterior, give me 1 second, I'm going to turn the model around again. Again, an anterior view, it means ventral. Thank you. Okay, so welcome back. Again, this is the model that represents your skeletal system, one of the 11 systems of the human body. And I am going to again direct your attention to our language of anatomy, the regional and directional terms using this full skeletal system. The skeletal system is going to represent 206 bones in the adult human skeleton. It is also going to represent the joints, okay? So our articulations. So superior is anything towards the top of the body. Inferior is anything down towards the bottom of the body. But that means all of this is going to have to be broken down in what's considered superior and inferior. So which one is the closest to the top? Which one is closest to the bottom? This is your breastbone. It is called the sternum. This is your hip bone. It is called the os coxae, okay? Our sternum, the breastbone, is superior to the hip bone, okay? Now let's take a look at our femur, the longest, largest, and strongest bone of the human body. This is your femur, your thigh bone. This bone, in comparison to your toes, your phalanges, will be considered superior. So the femur is superior to the phalanges, okay? Here are your phalanges again, and then this is your knee bone, the patella, your kneecap, okay? The patella. Now, when we discuss the patella and the phalanges, let's start with the phalanges. The phalanges are inferior to the patella bone. So that's how we would do that, okay? You can also use the terms proximal and distal when we're talking about limbs, okay? So our upper limb, our lower limb, okay? So proximal and distal. So this region here, which is your shoulder joint, is proximal to this region here, which is your elbow, okay? This region here, which is your wrist, is distal. It's further away. It is distal in comparison to the elbow, okay? Our wrist will now become proximal in comparison to our phalanges, the fingers. So the wrist is proximal to the phalanges. We can reverse that. The phalanges are distal in comparison to the wrist. So that's proximal and distal, superior and inferior. Let's do medial and lateral. Remember, our midline is anything that runs, the imaginary line that runs through the middle of the body. Anything closer to the midline is considered medial. So medial. Anything further away from the midline is considered lateral. So your sternum is considered medial. Your arm bone is considered lateral. Your collarbone, the clavicle, is medial here, and at the shoulder joint, it is lateral, okay? And again, our nose is medial, the ears are lateral, okay? Anterior, posterior, here is an anterior view of our skeletal model. Anterior also means ventral. Here is a posterior view. I don't know if he's gonna stay, but here is a posterior view of your model. Posterior meaning dorsal and the back of the body. So you can see the spinal cord and the vertebrae are going to be posterior or dorsal. Okay? Thank you. This is the skeletal system of the entire human body. So you see we have a lower limb on this model. So the upper limb is going to include the arms and the shoulder joints. The lower limb is going to include the legs and the hip joints, okay? That is considered our appendicular division. The axial division is going to be the head, the neck, and the torso. The head, the neck, and the torso. Our axial and appendicular divisions, which are the two major divisions of the human body. Thank you.